Hello, everyone. My name is Claire, and today I'm going to be talking about this week's discussion. We were asked to talk about the insight into personal traits and abilities that can help nurses to be efficient in their roles as nurse and nurse leaders. First, I'd like to talk about healthcare reform. Healthcare reforms are happening worldwide as we speak due to the large increase in population having increased healthcare costs and chronic diseases. This is related to nurses and nurse leaders to have roles to be efficient by having insight into their talents and abilities. The goal for almost every nurse should involve an efficient way to demand a safe, patient centered, accessible, quality, and affordable care for all patients. One personal ability that affects a nurse leader is by having social internship, which is designed to implement innovative ideas and practice models while achieving social justice between patients and providers. Therefore, it is essential to consider the personal experiences and work activities that influence increased practice as nurse leaders. Examples of unique talents and abilities that help nurses to be successful when leading involves having integrity. Integrity talents help establish personal integrities, which allow nurses to make the right decision during critical gestures in patient's treatment plan. This trait influences how nurses adapt to teach ethically valuable practices, which enables nurses to make efficient care decisions to create a safe environment for our patients. Another important aspect with talents are nurses who have critical thinking abilities, help build new nurses to develop their abilities to make decisions based on their healthcare environment, skills, and settings, which increases instances of multidisciplinary collaboration, thus helping new nurses to grow their own personal self with critical thinking. Emotional intelligence in leaders helps monitor new nurses cope with stressors. I believe emotional intelligence is one of the important and crucial talents of a nurse to show their abilities with nurse leaders. It can be counterproductive in influencing how to handle challenges when having emotional exhaustion and poor team collaboration. Some nurses have talents with communication skills, which helps increase the importance of collaboration with the provider to facilitate a addiction to excellence. And collaboration with support staff and senior executive to engage individualized patient care. I also believe another important talent is a nurse who has passion. Being committed to their passions helps promote also addiction to excellence. A nurse's purpose can amplify through preservative in a caregiving setting, which fosters this trait among new nurses and develops top-notch service to trainees from the leader's example. Another important talent involves a nurse who has talent of being passionate, dynamic influencer, thus inspiring, seen to influence other change in patient-nurse dynamics in which imagines with patients after their triage processes through organizational skills, therefore promoting professional socialization, respect, and trust in their fellow leaders. Being organized as a nurse is very essential. It keeps us on track, it keeps us to be on time, and it allows us to go home to our families to spend time with them as well. Being organized is very important to me. I am very organized, and it helps me a lot, especially between schoolwork and fluctuating my job. Another important thing I think is a talent is deploying motivational strategies that cater to individual personalities, calls a nurse talent, and providing mentorship to others by empowering them while guiding them towards understanding of their roles in every effort to identify learning opportunities through their autonomy, making the new nurses feel overwhelmed and being micromanaged. So as nurses, we should want to guide our fellow new nurses. We shouldn't micromanage them. We should give them a sense to micromanage themselves, because if we do that, it may overwhelm them. So that is an important aspect of being a mentor, is having motivational strategies to help influence our peers as nurse leaders. Having a profession involves having confident leadership, promoting new nurses to practice to the full extent of their capabilities. So far, I did receive my HRST review. I was able to get logged in and set up, but I'm completely unsure how to work it. I'm unsure about the practice quizzes that are due weekly. If we participate and do the quizzes, do we get full points, or is it based on our scoring? If it's a one shot, here is your score, I would like to know so that I can focus better during the questions and to miss as little as possible. But that is my only concern about the Hirsch review right now. And I appreciate everyone for listening. Thank you so much.